So once again, good morning, good afternoon, good evening, everyone, depending on where you're joining from. You're here today. It's our 6th experience sharing session for the first full learning cycle of the movement for Immunization Agenda 2030. And we started our first peer learning exercise in the IA2030 movement last Monday, which is situation analysis. And just a reminder that this exercise that started on the 25th of on the 21st of March will go right through till the 15th of April 2022. And here is just a reminder of the calendar. We are in week 1, and this week you are expected to draft the first version, that is, to prepare a first draft of your situation analysis, and also to join the platform Peer Grade, that is the platform where you'll be submitting your situation analysis next Friday. That is Friday, the 1st of April. The deadline is Friday, the 1st of April 2022. You don't want to miss that deadline. That is why I'll be inviting you today, right now, during this experience sharing session, to start. If once, while others are sharing their experience, are talking about their situation analysis, I'll be inviting you to be taking down notes, to be writing down, to be jotting down, already building your own situation analysis so that you can develop it. Because I know many of you, you're busy with work, that's your priority, with immunization activities, you may be called to the field. So if you are here, we have about 30 minutes together. Let's make this 30 minutes count for, let's make this 30 minutes count for us by using it to take a step forward, to make progress as far as the situation analysis is concerned. So if you have not yet been able to, if you have not yet joined Peer Grade and you are in the room with us right now, there is a short video tutorial from my colleague Zah that is very clear, step-by-step tutorial on how you can join Peer Grade. I'll encourage you, I'm sharing the link in the chat. I'll encourage you to have a look at that tutorial and join Peer Grade, because you have to do so before Friday. After Friday, it will be difficult, complicated. You may not be able to join Peer Grade. So don't hesitate to do so as soon as possible. Also, in terms of the situation analysis, I would like to invite, as I said earlier, our guide on the side, Dr. Francois Gaz, to briefly tell us what is the essentials, share with us the essentials of the situation analysis. What do we have to keep in mind as we analyze our situation based on the principal challenge that we face in our context as far as immunization is concerned? Warm welcome to you, Francois, and over to you.
Thank you, Charlotte, and hello to everyone on the call today. I think this session, or this week session, is extremely important. I think if we want to make progress, we need to be clear on the challenge you have to face. Very specific. It's always very difficult to be specific. What I meant is that a challenge is specific when you know the weight of the challenge towards your goal, which should be increasing coverage. It could be reducing dropout rate. It could be reducing vaccine hesitancy. You need to know the size of the problem to be sure that you're not wasting your time, effort, and resources, because the more you focus on the specificity of the challenge, you know you're focusing effort, and you will get the maximum out of your effort to make at least a difference towards your goal. I would say that the specificity of the challenge become when you know what the numbers, when you know you have some evidence. The numbers, where is the problem concentrated? If it concentrates, usually many problems are concentrated in some area, and you may find a way to get that information. And you need to really, look at the challenge in terms of the specificity that everybody can understand why you're addressing the challenge. What is the way that if you address, you could do better in your program, wherever you are, health facility, district, or nationwide. And of course, the second You have to do that with the information you have readily available and not presume, not just say, I lack money. Do you have evidence on how much money you're missing to do your outreach, for example? This is your problem. It could be a very specific problem. You have only money for 50% of your outreach, for example. And then the next step become really looking at the whys. There is the famous classic 5 whys. Why do we have the problem? And when you find one cause why, the cause may have different weight as well. And you need to find which cause has the most weight, and it could be 1, 2, or 3. And the third is why. There is always a why behind the why until you get to the root cause that help you to find the 2 or 3 corrective actions that will help you to do better. So today and this week is not focusing on the solution as we did before. It's focusing on having your challenge very specifically defined without losing too much time in making big studies, but sometimes quick and rapid studies can inform you a lot. Interviewing few mothers going to visit a village or a health center which have a lot of problems may help you to get some additional specific information. Over to you, Charlotte.
Thank you very much, Francois. And I see if you're just joining us, warm welcome to you. A number of participants in the room that have not activated their sound. So I'll just be sharing with you what you need to do in order to turn on the sound on your device. So please take a look at the screen. I hope they are not able to hear, but I hope that they can see their screens. To click on the join audio icon and then call using internet audio. So I hope that will help Martina, whose hand is raised, but is not able to hear. Now we have a number of participants that have made good progress on their dashboard in Learning Foundation. And if they have done so, I am sure they have also made progress with their situation analysis. And I'm going to be inviting them right now. If they're able to speak, Josephine Bombire Akurubu, you are over 90% with your progress in your dashboard. Are you able to unmute yourself to share your situation analysis with us? Josephine? If not, I'm going to turn towards, there is a Jemima Kwe. I hope, forgive me if I don't pronounce your name right. I'm asking you to unmute. So also, if you want to share your situation analysis today with us, and you are in the room, you have made progress, please don't hesitate to, okay, I see, don't hesitate to raise, okay, Jemima, I see you have unmuted yourself. Please do tell us who you are, where you're joining from, and share your situation analysis with us.
Okay, good morning, everyone. I'm Jemima Kwe from Ghana, and I'm a student, control student to be precise, in the University of Health and Allied Sciences. And actually, my situation analysis, it's my challenge. So like during my BT program, yeah, I came across, I went to the health promotion. We are supposed to do everything. That's when we go to all the centers, this control center, health information, promotion, and yeah. So I found myself in the health promotion center and I joined the vaccination team, right? Yeah. So I went to mobilize. Yeah. So went to the field to vaccinate and I went to the community to mobilize people to come in to take the jab. So I met this woman that I was trying to make a conversation with him. I greeted her and we talked, we had a chat and stuff. And I asked her about I wish taking the vaccine yet, and she said no. So confidently saying no, and I asked her why. She was like, religious beliefs. So I was like, why is she saying that? She's like, God, then they have gotten this perception that the COVID-19 vaccine is like it's like antichrist, like 666 and stuff. That's what she told me. So I was like, No, that's not the case because we have many routine vaccine that we give to the kids just to protect them and to boost their immune system from them not getting sick. So I made many, I educated her on many vaccines and stuff, and she, as long as we can, became convinced. Sorry, she became convinced as long as, and she was able to go and take a jab, and she even convinced most of her friends and family. Yeah. So that was my challenge and situation there. And what is it highlights what you know and what you do not know. Yeah, actually, I don't know. I wasn't at first. I was a student, so I wasn't like sorry, I wasn't that or much knowledgeable about the vaccine. Yeah, so I was kind of contemplating, but I tried my best to convince her that much. Yeah, so I quickly went to office to speak to the health promotion in charge, and I told her that she should make a stakeholders meeting. She should make a stakeholders meeting so that to invite she will invite big community community leaders, maybe pastors and Islamic leaders, so that we will educate them on their vaccines, so they'll be able to preach to their congregation. Yeah. So that was the actions I took. Yeah. So I drew conclusion that um, some people are getting religious perception. They are really religious perception about the vaccines. A lot of people are in my country who has a lot of religious perception, and some people are even getting some false videos from their phones. Like there'll be a video on their phone. They'll be like, if you take the jab, when you took the jab, when you put a torchlight there, the lights will be on. And there are many misconceptions about the vaccines. Yeah, so I made it a point. The action I took, I talked to my health promotion officers, make a stakeholders meeting to address this situation. But people are getting many misconceptions about the vaccine. Thank you very much.
Okay, thank you very much, Jemima Kwe, for sharing that experience with us. And Francois, I want to know, do you have any questions for Jemima? Though I see she already took a step further as far as the challenge was concerned.
No, sorry. Thank you for this presentation and sharing. I think just one point is that I'm glad you took actions and you do things, but here that session is focused on describing your problem and not the action to take that will come next week, sorry, or in 2 weeks' time. But here is more focusing on the specificity of your problem and how you find out what are the evidence and how big was this misconception, for example, about is it like one communities, many communities? And of course, why is this misconception? Could be linked to COVID, as you mentioned. And now is how do you find out, the cause, the reasons, in order to come to the root cause that will help you to define the specific corrective measure. When you find the specific root cause, you are close to the solution. So here, I would like people to focus on, have they understood really the problem? Is it very clear for them? Where did the information come from? It's just rumors, or was it data that tell you? Was it a visit? Was it a reported information? This is extremely important. Of course, you will not have all the elements, but you may, even if you have 50% of the information and evidence, it's good to move. We don't want in this step to go and do a lot of surveys and exercise, but having the minimum evidence for that it is a big problem, how big is the problem, does it affect, is it concentrated or not, and then look for some of the root cause. Over to you, Charlotte.
Okay, thank you very much, Francois. And I see there is a raised hand, actually two. So I'm going to invite Edwin Simple. Edwin Simple, are you able to unmute yourself? And please do start by introducing. And if you're just joining us, warm welcome to you. So today it's our experience sharing session, and we are focusing on situation analysis. And I said at the beginning, and I want to reiterate, if you have not yet started or you have just begun working on your situation analysis, we have to make the most of the 30 minutes that we have together. So while the presentations are going on, the questions are being asked, you can be taking down some notes that will help you later on to enrich your own situation analysis. So over to you, Edwin Simple.
Thank you very much. My name is Edwin Simple. I'm from Nigeria. I work with African Field Epidemiology Network. My dear and apprentice, presently I am supporting the COVID-19 mass vaccination campaign in Adamawa and Kwara, supporting the National Primary Healthcare Development Agency to reach at least 53% of the state target population in 17 LGAs in Adamawa, 17 LGAs in Adamawa and 13 LGAs in Kwara. The strategies we've deployed so far is the advocacy to stakeholders at the state and LGA level. We recruited and trained MVC teams. We deployed social mobilization strategies with the use of megaphones and a pre-recorded announcement music via a Bluetooth device. The use of Grid 3 GIS was used to identify high, medium, and low populated vaccination sites. We also deployed mass vaccination teams to run a mobile fixed post in most of the highly populated vaccination sites. Teams were also deployed to university environments, and motorized campaign was also deployed to the universities to support social mobilization. And key takeaway to this is that in the wave of heavy vaccine hesitancy facing the COVID-19 vaccination, the support has been able to help the states reach at least 45% of the expected target. The Grid 3 GIS has been used to make the team's daily implementation plan and help to prioritize the daily work focusing on the most highly populated sites. The initially vaccination sites situated just at the health facility showed that the shortcoming of reaching most of the unreached, hence the need to instigate the mass vaccination campaign. Advocacy was done to the stakeholders in identified universities and deployed of mixed strategy social mobilization, which is the use of megaphone and motorized campaign. How we are measuring this progress, data is reported daily by the MVC teams to their linked health facility. These MVC teams were actually linked to the health facility that is close to them. Then the health facility will forward this data to the LGA, which the LGA will forward the data to the state. The data is aggregated at the state level, and this data is analyzed daily to review twice a week at the national level to measure progress. And supportive supervision is conducted once in 2 weeks, 2 months, for a desk review of the data sent to the health facility with what is transmitted to the LGA. This actually help to identify data discrepancy and missing data, and reasons for data discrepancy was also shared. I observed that from initial engagement, where it was from the top of the stakeholders to the lower stakeholders, However, I've learned that it's better engagement is done from the stakeholders at the grassroots level, which is the religious leaders that is close to the population, and also the community leaders that is close to the population. And this has tremendously improved the acceptability of the vaccine among the population. Thank you.
Okay, thank you very much, Edwin Simple, for sharing that experience. The time is going so fast, so I'm not going to waste so much of your time. So I'll just ask Francois, Francois, questions for Edwin Simple. That thing seems like he already has everything clearly mapped out in his mind as to what they need to do.
Thank you, Charlotte, and thank you for presenting. You know, this session is more to figure out how did you figure out your problem, what source of data do you use to classify high, medium, and low risk, which seems to be a very good analysis that you have done of your challenge. So could you clarify a little bit more on what did you do to assess your challenge more specifically, the weight of your challenge, the concentration, where was the problem, and the cause of the problem? How did you do that in practice? The solutions are great, you have done the job, but I think for people in that phase of the exercise, it is to understand how you came to your conclusions that led to the activities you have implemented. Thank you.
Thank you, Francois. Over to you, Edwin.
Please,
Edwin?
I think he was actually breaking a bit. I don't know if it is from my network or his network. I didn't get him clear, but what I got is how did I actually assess my problem. And I looked at over a period of time in the reporting, we'll find out that the reporting of getting number of persons to be vaccinated was becoming a problem, while as this there are a number of these populations there, and we kept asking how does it mean that this does not exist in the community. So the GIS was then deployed to assess those communities, to actually help the team to prioritize on where to go, because over the period we find out that the team will go and work in the whole day and only report that they vaccinated just 3 persons. Sometimes they'll say they vaccinated 7, which means they were actually prioritizing the very low populated site. So the GIS actually helped the teams to target plan their daily activities, ensure that the first and foremost prioritize the highly populated sites where they can get a much number of persons. Specifically, you go to most of the religious places and markets, and just to help as a pointer to direct the teams and where the markets are situated and where the churches are situated for the teams to actually get this number. And also, like I said, one other thing we did was to see that the teams also deployed to universities, where we see that most of the people that are within the age range of these vaccinations are mostly situated. Thank you.
Thank you, Edwin. And this is really answering the question, your review of your data to figure out, the size of the problem and where it was more important than others. The second was where the problem was concentrated. The third one, I'm not absolutely clear. What was the cause of those low vaccination coverage? Was it non-service? Was service were not delivered there? Or why was it, your concentrated area? Why the people were not immunized in those areas? Were they dispersing their effort and not concentrated? Can you tell me what the cause were? Why of this low coverage?
Okay. So I think generally we know that there's a high level of vaccine hesitancy among the population, which also instigated the social mobilization aspect of this project. And like I said, the teams actually, because they were just deployed into the community, they didn't get a direction of where they can actually meet these populations and what actually makes people together at a point. They didn't actually have that idea. But after the analysis of most of the data that is being sent, and the 3 GIS was then requested to be deployed to help the teams to actually get where they can get these numbers. Thank you very much.
Thank you. That clarifies the question. That it again was reviewing your data and looking at the low performance of your team compared to the number expected children immunized based on your data, and that helped you to focus the interventions and get to the cause and the solution with what you have described extensively. Thank you. And maybe there's some question from participants who want more clarification on the situation analysis.
So far, there is no question in the chat concerning Edwin's situation analysis. Don't hesitate to leave your comments in the chat or raise your hand if you want to speak. But I actually see there was a Farm Daniel whose hand was raised long before. I am sure probably Farm Daniel wants to share his own situation analysis. So Farm Daniel, Chrissy, Kwam, I'm inviting you to unmute yourself.
All
And
right.
I see you've already done so. Please go ahead. Tell us who you are, where you're joining from.
Thank you so much. I am a pharmacist by profession, a clinical pharmacist by profession, and I'm Farm Daniel Kwam from Ghana. And I have almost 19 years of experience working as a pharmacist. And I've spent almost 17 years working in the northern part of the country, where the people are mostly deprived, doing peasant farming, rearing animals, and doing other jobs. And my work, I work currently as the head of pharmaceutical services of the Upper West Regional Hospital. And due to my role in the region and in the national level, I travel a lot. And when we started this COVID-19 vaccination somewhere last year, May, June, July, as I travel along, I began hearing people saying that we will not take this vaccine. We won't take this vaccine. Oh, whatever the president took as a demonstration, we don't believe it to be the actual vaccine, so we will not take it. So when I returned finally to my place of work, I decided also to do a little survey around. And because of that, I came up with this challenge: hesitancy and refusal of COVID-19 vaccination of some people in one municipality. And my area covered vaccination coverage and equity. And the question I want to ask to find answers to is why hesitancy and refusal of COVID-19 vaccination of some people in the municipality, even though vaccines are available. Then I just decided that, okay, at the hospital, the small survey that I can do is that I will look at the indigents that come, the general public and the healthcare workers. I want to get a data, and the data will come as a result from a key informant interviews. So I just decided to do some interviews, concentrating first on the general public who visit the hospital and also the healthcare workers. And it was shocking, some of the results I had from them based on the interviews I did with them. What I realized was from the general public, they said that, the government started very well of a vigorous public health education in 2020 and the early 21, but now it has reduced. And also their weekly television update by the health authorities that started in 2020 to 21 to have almost come to a standstill. They don't do it again. And they have realized that the security agencies, the district assemblies that used to monitor adherence to COVID-19 protocols have also stopped. And government and some politicians also are not consistent with some adherence to COVID-19 protocols, especially during our election year 2020 and social gatherings. So they said that the general public said that these first four reasons above, they believe that COVID-19 infection is no more. If COVID-19 infection is there, they wouldn't have loosened their monitoring of adherence to protocol, their updates on the weekly television, the vigorous way they were doing public education. And during the election year, they saw how some politicians and didn't even care of the protocols that were set in place, social distancing and the number of people that should be in a place. They didn't even regard it. So they believe that COVID-19 infection is no more. And even if it is, then it's the minor type that cures by itself without any admission or any medication. So for them, there's no need for them to take vaccines. And also the same general public, some of them came out to say that they believe the injection, the vaccine they are going to take is not really the vaccine because it is a chemical. And the men even said that it might even make them impotent. That is what they are hearing. And also some of them had fears of the adverse reactions after taking the COVID-19 vaccines. And also some of them even clearly stated that they heard bad comments from some health workers about the vaccines, that they will not take it as health workers because of the side effect. So these negative factors influence them and they are not ready to even to take the vaccine. And also on social media and the general media, they have been receiving a lot of videos and a lot of information that tries to undermine the quality of the vaccines. So for them, they won't take it. Then that was the general public. Then I went ahead to do the healthcare workers to find out from their side what they also will be their reasons, the whys and all those. Then they were quick. They said that some of the healthcare workers said that they know that in actual fact, development of medicines and vaccines for that matter goes through a lot of stages. But they are so surprised the very quick nature in which COVID-19 vaccines were made. So they believe that some of the processes and the stages have been shortchanged. They couldn't go through all of them. And some of the health workers also went ahead to say that based on what they hear from online and other social commentators, the vaccines are not good for man to take. And that is why they believe the general population and they themselves are not taking. And also I went further to get some healthcare workers who are involved, involved in this thing. And they said that there's actually inadequate funds from the healthcare workers' perspective, because and that inadequate funds could contribute to the hesitancy and refusal of people not taking the vaccines, in the sense that in the general immunization, general vaccination, they use a lot of skilled healthcare workers and community volunteers to do a lot of community mobilization that will bring people to come and take the vaccines. But with this COVID-19 vaccine, though they use health workers, but they were not many. They were just some few skilled healthcare workers. So they believe that because of the inadequate funds, it affected recruitment of healthcare workers, more skilled healthcare workers and community volunteers that could have done a lot of community mobilization. And also, they also made a comment that the bad comment from some of the healthcare workers themselves is one, like as they talk, the bad comment about the adverse reactions and the drug not good alone could also contribute to the hesitancy. And also, they also went ahead that from them, looking at the background of our elections, how it happened, some of them wonder whether or not the existence of COVID-19 is true, even from the onset, due to double standards by some government officials and certain politicians. And they even think that there's a myth that the government possibly might be deceiving the populace and using the situation maybe to access more funds to fight the pandemic. So they believe that these are some of the factors that could have.
Daniel, thank you so much. Forgive me for interrupting you, but I see we have passed the 30-minute mark for the session. And remember, we try to always respect your time. We know you're busy immunization professionals. We don't want to keep you here more than necessary. But I think Daniel's situation analysis was very in-depth and very engaging. But before we continue, before I turn towards Francois, I'd like to invite you, ask my usual question. Do you want us to continue? If you want us to continue with this session for another maybe 15 minutes, can you type yes or more in the chat? Can you type yes or more in the chat if you like us to continue? Okay, thank you, Odukoya Adesoji. Okay, thank you very much. Yes. Okay, so lots of yeses, and the Francois and I, of course, we are ready and available to continue again. So Francois, this is quite an in-depth, profound situation analysis that has been carried out by Daniel Quakwam. So do you have any additional questions to ask him so that he can just round up before on this situation analysis, maybe on his findings?
Thank you, Charlotte, and thank you, Farm and Daniel. I think first I congratulate you for having tried to find the reasons for vaccine hesitancy, the cause. And I think a lesson I'm hearing is that you decided that to do it where you work, looking at general public, looking at healthcare worker, which prevented to make it a sort of time-consuming survey. I'm sure it has taken time anyway, but you did it locally and very practical approach to try and to understand the cause of vaccine hesitancy. Now you have listed a comprehensive list of causes. If I ask you, which are the three main causes from your studies that you would like to tackle, not to address all problems, all reasons for the vaccine hesitancy, what would be the most frequent, the most important root cause of the problem that you would like to address to reduce vaccine hesitancy? What would they be? And what proportion those three causes represent among the list of causes you have mentioned, which is very educative?
Okay, thank you very much. I believe that going through all, I realize it is more of a detailed information that have not been given to the public and even to the healthcare workers, because this I did it by patients who were coming in within the locality to find out, the municipality to find from them, and the healthcare workers that I know. So I realized that the major thing that we need to tackle more is on the public health education, to give them very detailed information about the vaccines and its safety. That is where I have seen it is coming. It is another serious point, because if this is coming from the community members themselves and some healthcare workers, then we need to tackle that, because when you give them the most important information, detailed information of what they need and the safety profile of the vaccines, I believe that that will be one of the most area to resolve most of the issues that they have raised, if as you use even Pareto chart to work on it. So I believe that is the major area we need to look at. And there is another aspect. I think that most of them is something that can be done within the municipality by the municipal health directorate. Is one of the things is, if the government nationally, the national weekly update that they used to do is not there, we can localize it by the district health management team together with the local district assembly and the regional coordinating council to have their own either weekly or monthly update of COVID-19 infection and even the vaccination in the town hall meeting, and that could also inform the populace about the trend of the infection and the vaccination. Thank you.
Thank you very much. I think we're going to ask people have questions to you. I think it's a great story. You have identified the two main causes that you want to address. You have identified a lot of content for your information of the public through your quick investigation. How long it took you, just a last question, how long it took you to do that survey in your hospital?
Actually, I used about 6 weeks just to do that investigation. And I did it in such a way that it was the period we were doing the mass COVID-19 vaccination. So I used that because I'm also a trained pharmacist vaccinator. So I was with the team. So mine was to find out more from people who are entering the facility. So I used that during the period. I'll be there asking those entering the facility who are sick. I asked them whether they have taken it or they have not taken it, or this thing. That is what I did. And also my own healthcare workers that are around at the facility. As I work there, I'm able to ask them from various departments, and also outside the hospital, other health care workers that I knew they were involved in the vaccination. I also asked them on base because I'm well known in the region, so I'm able to connect to so many people if I need to.
Yeah. Thank you very much, and I think it's a nice sharing of experience that maybe at the health facility level, a quick survey with the local staff on people coming in, on mothers, on health worker, can lead to you to some critical information to target your case response, your vaccine hesitancy response. So thank you very much. Over to you, Charlotte.
Thank you so much, Francois. Thank you from Daniel. There's a question in the chat from James Tukolon, VT Tukolon, that says, what proportion of healthcare workers, as per your situation analysis, so what was the proportion of healthcare workers did you question? And maybe I can invite James, if James is able to unmute, to clearly ask his question. Is it in terms of we're hesitant or in terms of the total sample size? So James, I don't know if you're able to unmute yourself.
Yes,
okay.
Yes. I think basically I'll look at the sample size he was talking about. So because if you do the survey, sometimes you have to look at the sample that you are working with. So was it that all of the healthcare workers he was asking? So what was the main sample size you were working with this situation that you're talking about?
Okay. Because it was my own survey that I just want to find out, what I realized that with the healthcare workers in the hospital, we are almost about 800. So I decided to pick about 200 of them to ask them these questions, and the 200 from within, and I was also able to ask for about 50 people outside. So them other healthcare workers outside the hospital, but they work within the municipality. So I had about 250 of them, and the 250 that I had of them, I realized that about 50 out of the 200 healthcare workers themselves have not taken the vaccines based on these reasons. So that was when I need to come in with my skills in immunization and vaccination, and as a pharmacist to really to talk to them and let them understand that I'm a pharmacist myself. Look at my card. I have done my immunization. This is it, my COVID-19. So I talked to them, and that has influenced almost all of them, and they have gone in to take their vaccination. But with the community members that come in from the when they are sick to the hospital, the general public, I was able to interview because I wanted to compare exactly. I was also able to interview 250 of them. So in all, I interviewed almost about 500 in that period. And out of the general public, as for the general public, almost about 80 of them have not taken it out of the 250 that I did. 50 from the health workers and the general public, about 80. But as I keep on talking to them, because it's a wider area, so doing follow-up is also another thing, to follow them up, whether they will go and take it and all those things. But some of them, I have their numbers, I call to find out, and they come to the facility to seek help. So when they come, I tell them if they have taken it, they should bring their card for me to see that they have taken it. And I think there is improvement over the period. Yeah. Thank you.
Thank you.
Okay, thank you very much. Thank you very much, Daniel. I'm getting indications that my connectivity is unstable. I hope you're able to hear me, Francois.
Yes.
Okay, thank you. So there is Nasir Safe Umar, whose hand has.
Nasir, unmute. Are you unmuted?
Has been raised for quite well since you're able to unmute yourself. Do you have with Daniel's situation analysis? Have you been faced with a similar challenge? What did?
Okay.
Yeah. Hello. Can you hear me now?
Yes.
Yeah. So I would like to say really thank you for pharmacist Daniel Kwesi.
In terms of Nasir Tafe, I see your mic is unmuted.
Yeah. Okay.
Over to you, please.
Can I go ahead,
Yes.
please?
Yes.
Yeah. So thank you so much, Charlotte, Francois, and also thank you a lot, Pharmacist Daniel Kwesi. And I'm really excited by the key informant interview that you have actually executed, because we did something similar back in my place. And I think I'm really learning a lot from what you have done. And one question I have very quickly for you, because I think I'm gonna contact you maybe privately to get some more ideas from you later. But the question that I really want you to help me with right now, because of the time factor, is that, you know, among you mentioned about, you know, when Dr. Francois asked you which are the 3 most important findings that you want to address with regards to the challenges here, you actually explain about a way of giving the most relevant information to the individuals of vaccine hesitancy, whether from among the healthcare workers or among the general public that you found with the different ratios. So my question here is, how, in what form do you intend, or you have, if you haven't done it, but if you have done it, in which form did you find, given that information, to be able to resolve the vaccine hesitancy? In which form did you find to be most relevant or most effective? Which form? Is it in terms of some kind of printed materials, or by talking one-to-one, outreaching, or through radio, or what have you? Please, I hope I explained myself.
Yeah, thank you very much. What I have realized it worked is that there are structures there. I don't want to reinvent the wheel. There are structures that are there in doing this. And so all we needed to do, one, is on the use of monthly community debates, weekly radio discussions, home visit, and doing social gatherings, because our place, they value social gatherings a lot, like funerals and festivals, and even market. When doing market, they have their market normally weekly market, and when they have it during that period, you use it as a form of what? Public education for them. That is on the part of the general public. But on the part of the healthcare workers, the existing protocol is that every month they meet to review their report and everything. So that time should be used. They have their monthly meeting. That meetings should be used as a sensitization, and that is what we have done. We are using those meetings as sensitization to give that information to them. So it is their sensitization meetings, and also using the various radio discussion and the community debates and home visit to give that. And it is working, because the existing structures that work. Yeah. Thank you.
Yeah. So thank you so much, really. And if I may just quickly add one thing here, I hope you guys are listening to me.
Yes.
Yes, loud and clear.
Yeah. So I really appreciate this, and I believe we have also been exploring all this what he has mentioned now. But one other thing I think that may be important to add here is that is the need to do capacity building with regards to being able to resolve the problems. You know, so because you alone and the few that have helped you to be able to do the, you know, all these findings, but when it comes to implementing the actual methods or the materials that you're going to use to be able to resolve this, you alone cannot do it. Few people cannot do it. You need to train more people. So capacity building is very important. So I'm suggesting, instead of having that during that kind of monthly meeting or something like that, whether you create a time within the monthly meeting times, or you purposely create another time separately and get those people who are really interested in getting involved, and then give them proper training so that they will be, you know, going ahead, step down kind of training, and then it goes, so that by the time you know it, so many people will be able to resolve the issue instead of just from the top level that you started. Thank you.
Okay, thank you very much. I've really outlined all this. There's a capacity building aspect of training in here it is all in my situational analysis, but because I can't talk about all of them. And also within my facility itself, we have a weekly clinical meetings, of which all the various heads and most of them come, and we do presentation. And one of the presentation is for me to do is on pharmacovigilance. And pharmacovigilance is all about these adverse reactions and all those things. So a lot has been given to me, of which I will use it as a capacity building within the facility itself. But outside the facility, where the municipal health directorate needs to come in, because we have other community health nurses, as we said, in the various communities. So they will come in to do the major training in that, in conjunction with the our Food and Drugs Authority within the region, on training on the AEFIs and the rest. So thank you very much, my brother. Thank you. Thank you.
And thank you for, maybe Charlotte, can I?
Yes, Francois, please go ahead.
I think felicitation for having those survey, this key informant survey, because you now understand the cause of vaccine hesitancy, you understand the main cause, and you have all the elements that can be part of your solution, because every cause mentioned, as you said, needs to be addressed in those meetings that you are now planning to have. And it's important to listen to people and to build your message when you will have to address vaccine hesitancy. So I think it's your study is extremely important. I think study can be based on your capacity, large or big, but sometimes quick studies can also reveal a lot of information. I think you stress one thing important is that the sustainability of keeping the information going, because you said a lot of problem occurred when suddenly there was silence about COVID. So I think you raise many important information through your situation analysis. Thank you very much.
Thank you so much, Fam Daniel. Thank you, Francois. And I see Joy Osifo that asked in the chat, Fam Daniel, have you been able to publish your work? So I think it's still a work in progress. We'll probably be looking forward to seeing what will come out at the end of your findings. And thanks to all those who have been leaving comments in the chat. Reda has also pasted some very important links in the chat. That is full guidance for you on situation analysis, video tutorials. And I want to thank Surya Prakash Mishra for the link that they have shared in the chat that could be useful reading for all for participants around the topic that we are looking at today. So before we go, I would like you to there is a link that I'm going to put in the chat, and I want you right now to click on that link. I want you to click on the link that I'm sharing in the chat. It's very important, and I'll explain to you why you should click on that link. So please, can you go ahead and click on the link that I've just shared in the chat, please? And when you click on the link, just go ahead and say done. So once you click on the link, you can type done in the chat once you have clicked on the link. So if you click on that link, it comes to, and thanks Reda for showing the example, done, that's wonderful. So once you click on that link, it brings you to this very important page, especially if you have not yet started or you have just begun, you have not yet made progress as far as your situation analysis is concerned. So once you click, please take the time to watch this video. You can actually download it by clicking on the download on this icon. You can click there to download an MP4 version of the video and watch the video. It is to show you clearly what an actual situation analysis looks like. And thanks, Reda, for also sharing the link to the podcast in the chat. You can subscribe to our podcast to hear the video, to hear the audio of this particular post. And then it shows you also how to focus your situation analysis and get it done. And then a simple example, the 5 why, the rule of the 5 why for you to do a root cause analysis. So I'll encourage you to take a look at that. But one thing you have to keep in mind and you need to pay attention to is that once you have finished going through this post, do not forget to click on post completed. Do not forget to click on complete post, because that is one thing that many of us, I myself, if I am at 34% completeness on my dashboard, is because you go through the task and then you forget to click on this little red icon, complete post. So once you're through, you click on complete post, and then you can use this little arrow to go to the next task that is on your dashboard, so that you can also go through it here. And this is another very important, I would like you to click on that little arrow that I showed earlier on. Just click, you come and see the next post. That is, you click on this little arrow. Please go ahead and do what I'm doing now as well. You click on the little arrow, and then you'll see how to avoid most common mistakes in situation analysis. And here is another video tutorial from Reda that is telling you, looking at some people that have already shared their situation analysis, some common mistakes that they made, you know, and also we have our two key documents, our two most important valuable documents for situation analysis. That is the rubric and the word template. So please make sure that if you're writing a situation analysis, you are using the word template that is that was prepared for that. And I'm just going to share the link with you right now in the chat. So that is, if you have succeeded to do this and you go through the video, click on complete post completed, and you see as I clicked on that the first time, my percentage moved upwards immediately. So it's very important that you mark the progress that you're making on your personal dashboard. It helps you to know if you're making progress, and it will also help us to know, so that we'll not be sending you reminders to say you're lagging behind. Meanwhile, the only reason why you are not up to date is because you forgot to do a very simple thing, that is post complete. One last thing I wanted to share with you before we separate today is once you log back into your dashboard on Learning.Foundation, for you to go directly to what you have missed, to the exercise, the task that you have not yet completed, click on resume exercise. Resume exercise. Once you click here, instead of me having to scroll down to look for where I ended, when I click on resume exercise, it takes me to the last post that I had to view on my dashboard. I am sure that is the strategy that Jemima Cray and others use to be able to be at 90%, 97% completion on their dashboard. So I thought it's very important for us to have a look at this and to share this together. So tomorrow, if you're having any challenges, you have not yet joined Peer Grid, you're having any challenges with that, and also still with understanding the situation analysis process, we have a date tomorrow at 1:30 p.m. Geneva time for our technical support session. So join us tomorrow at 12:30 Geneva time for the technical support session. I'm just going to share the registration link with you once again in the chat. So we have our technical support session tomorrow at 1:30 p.m. Geneva time. So if you're having any technical challenges, go ahead and join us. And we have our next experience sharing session again next Tuesday at 5 p.m. Geneva time with Dr. Francois Gaz and myself. So thank you once again. I want to especially thank Francois for his guidance. Thank you, Edwin Simple. Thank you, Fam Daniel Kwekwam. Thank you, Jemima Kwe, for volunteering to share your experiences today, and for all those who shared their own thoughts, their comments, their questions in the chat. I'm inviting you right now to unmute yourself. Please, can you go ahead? I'm asking everyone to unmute. And I would like us to do what we are so good at doing, that is putting our hands together for ourselves for what we have done. And please also don't forget to leave your comments to reflect, tell us how you found this session.
Thank you, Charlotte.
How it has helped you.
See you tomorrow. Thank you, Dr. Thank you, Charlotte. Really appreciate your company. Really appreciate your insight. Thank you. Thank you. Thank you. Thank you.